Well, good morning and welcome to HSABC's webinar, Managing High Stress Situations with Hilary McBride. My name is Sarah Kift and I'm your host for today. Just a little bit about me. I've worked in the frontline nonprofit sector for about 15 years, including in Vancouver's downtown east side at Carnegie Community Centre. And I develop and host webinars for HSABC as well as instruct mental health first aid and produce podcasts for mental health organizations here in Vancouver. So when you're using the question section, that's me who you'll be chatting to. And I'll do my best to share your questions and comments with Hilary as they come up. I just want to say it's a stressful time for so many of us right now, as well as those we provide services to. So I want to say thank you for taking the time to join us today. And hopefully the content we provide will help you to lead well and with courage in the midst of this crisis. So I'm going to run a very quick poll here, and this just gives us a sense of, it gives you a chance to reflect and gives Hilary a sense of what you might be dealing with. So just take a minute to fill that out. There's a section that says other. So what's your biggest stressor at work right now? You can check all that apply. Is it managing your workload, dealing with clients and patrons, your work relationships and colleagues? And this is anonymous, so if you're all together on a call, nobody else will see your answer. Or is it implementing all the policy and all the directives right now, getting tasks done, or other? And if you chose other, just type into the question section and we'll add those to the pile here. Someone's mentioning balancing working from home and the office, and that is definitely, balancing your home life right now and work life can be very difficult. 62% implementing policy and getting tasks done, especially with all of the extra policy and procedure that's going around right now. 23% dealing with clients and patrons, 31% managing the workload, 46% work relationships and colleagues, and a good chunk chose other. Now, of course, you're allowed to choose multiple, so it won't add up to 100. But yeah, I think all of these things are only heightened in a time of crisis like we're in at the moment. So thank you for sharing that with me. All right, now the best part, I get to introduce Hilary to you. Dr. Hilary McBride is here on the screen, and she's here with us. And she holds a PhD in counseling psychology from the University of British Columbia, as well as a Master of Arts in counseling psychology. And she's a registered clinical counselor with advanced skills and training in the areas of trauma, eating disorders, body image, and marriage and relationship therapy. But she is also skilled in many different kinds of therapy, including attachment work, psychotherapy, cognitive behavioral therapy, various trauma and body-based therapies, feminist approaches to mental health, EMDR, lifespan, OEI, mindfulness, and meaning and insight-based therapies. She's got quite a few qualifications. But she's also a compassionate and powerful and intelligent public speaker, and she's earned many awards for her clinical research. And she's a very down-to-earth, practical, and caring therapist who works to empower others to be seen and to do their best work. And I'm really thankful to have her here with us today. Welcome, Hilary.
Hi, Sarah, and hi, everybody. So happy to be with you this morning. Okay, everybody, we're going to jump in because we have a lot of material to get through, and I want to make sure that we have lots of time at the end for questions. So this is the name of our presentation. Hopefully we're all on the same date here together. I know time feels strange right now. So if you were wondering what date it is, where you are, what's happening, we're April 29th and we're talking about managing high stress situations. To give you a bit of a roadmap of where we're headed today, I'll show you in the presentation overview what we're going to be talking about. I always like to start with a really well-grounded why too. Why are we talking about this? Why does it matter? Why are these things that we need to learn? And you might have experiences from the workplace that immediately answer this question where you think, wow, if I had better skills and tools to manage a high stress situation, I would have fared better or felt more supported or more equipped or been able to help other people better. But ultimately, when we feel overwhelmed, it's really difficult for us to support others well. And high stress situations do that to us. They're high stress, usually for the person we're interacting with, but also for us. And when we have strategies to manage that overwhelm, to make sense of it, to help ourselves through it, then we can ultimately support others well, support ourselves well, and support others well. So today, here's where we're headed. We're going to identify what high stress situations are and how they occur. Learn some skills to help us respond to and diffuse these situations so that you have some practicals. Find ways to support ourselves before, during, and after high stress situations, because we are part of that situation. It's impacting us. And unfortunately, if we're not feeling most resourced, most grounded, most present, we often contribute to the high stress situation without even knowing it. And then because this is part of what's happening for a lot of people and their stressors, and even for us and what's activating us and making it more difficult for us to do our job, we're going to talk a little bit about COVID-related situations and how we can take care of ourselves and respond to others well. So that's our roadmap. I want to start at the end. So I'm going to ask you some questions at the end, some things to think about, and so that you don't feel overwhelmed or blindsided, and to help guide the way that you're listening to this presentation, I want for you to think about some of these prompts. Something to remember. This could be a fact or a specific piece of information where you think, whoa, I need to remember that specific thing. Something I already do well. This is really important when we're learning, to be able to identify where our strengths are, to see if there's some resonance with what I'm saying. If I'm presenting an idea or a skill and you think, yeah, I actually did that this week, or I know how to do that, that's a moment to recognize you're thriving there. That's important. Something to change. One of the things we want to do more or less of, and something I need to practice. And practice might feel different than change. Change might be overall, that's something you need to direct some attention to, but there might be a specific thing you need to practice or would like to practice, like wording, or even using some of the skills around matching emotions or emotion regulation. We'll be talking about all of that stuff in the presentation. But if there is a scrap piece of paper next to you, or even a note that you can open up in your phone, and you want to jot some of these down to guide your listening, that will really shape your ability to take away something concrete. And you'll see that there are only 4 somethings here. I'm going to be going through a ton of material, but often when we have so much material coming at us, it's really hard for us to integrate it and take it all in. If we narrow down to some specific points that really work for us, we're more likely to be effective in retaining those specific things and trying to remember all of it. So just stick with the things that speak out to you, that jump out to you, that really resonate, and see if you can take some notes about those things. Just a few, not too many. Okay, we're going to start with a little exercise. Because we're talking about high stress situations, I'd like for you, as long as this felt safe to do and it felt like something you could do in your home or wherever you are without it feeling too activating, I'd like for you to think back to a work situation that was high stress. Again, if there was trauma involved and it feels unsafe to think about it, or at least right now, please pick something that feels more mild, something that might not be so intense for you. When you've had that called to mind, think a little bit about the context. Where were you? What was going on? What was happening around you? And thinking about what the other person did. Was something said? Was there some behavior that was challenging or that felt unsafe? And what happened for you? What happened in your feelings? What did you think? What did you eventually do? You might even take a moment to remember what that feeling was like in your body. And how did it all resolve? What happened in the end? And sometimes when we ask this question, we realize it didn't really resolve. Something felt unfinished. And so once you have all of those things, in some ways, this is the most important question of them all. What do you notice right now, remembering that? You might notice some heat in your body. You might notice racing hard or shallow breaths, or it might feel really far away as a memory, like it happened so long ago, or like it's right there, right in front of you. It's happening right now. So taking a moment just to notice the impact that the remembering has on you. These situations impact us, right? They stay with us. And I'll explain a little bit about why that is when we get into the presentation itself. But understanding our reactions, having these experiences call to mind can help us have something specific, a lens through which to hear the rest of the content, perhaps some examples at the ready to think, oh, I could have tried that, I could have tried that, but also a compassionate understanding about how we're all people. We've all been through things, we all have histories, we all have experiences that felt overwhelming and scary for us, and that shapes what we do in the future. Ultimately, remembering an experience you had that was high stress can help build compassion for yourself and for other people when we're thinking about helping them through high stress situations. So let's take a moment here to self-regulate. Often when we thought of something stressful, our heart rate is beating faster than normal. We're actually changing the way that we think. I'll explain a little bit more about that in a moment. But together, why don't we put our feet on the floor if that's something that's available to you, perhaps shifting your body in your seat, allowing yourself to feel perhaps upright, perhaps alert, perhaps relaxed. And we'll take a few breaths together. Bringing yourself back into this moment. Sometimes thinking about our stressful experiences pulls us out of what's happening right now. Good work. And perhaps you want to notice what's around you for a moment. Noticing, see if you can look for something blue around you. And then maybe something that's square, looking for something square. And then looking for or touching something that's soft. And what we're doing without you necessarily even realizing it is we're practicing some of the skills that can be helpful for you on the back end of a stressful situation. When your heart rate is increased, when you've got through something that feels difficult or scary, we need to find our way back to rest, back to a place of knowing it's over, we're here, and we're safe. And the skills that we just used can be helpful from anything from having a difficult interaction at the bank to grocery shopping these days, or trying to parent your kids. And then, of course, in a stressful situation at work, helping our bodies remember that we are in the present helps us react to what's happening right in front of us and not all of the stress that we're carrying from the before and acting out based on old information. Okay, so we're going to jump in and do a little bit of the understanding what's going on in high stress situations. Here's my understanding of it, integrating things from interpersonal neurobiology and affective neuroscience to understand our stress responses and how that shapes how we show up in the world around us. So we experience a threat. We could think of that as a trigger. There's something that feels dangerous to us. And that could be a threat or a trigger that's inside of us, like an overwhelming feeling, perhaps even the sense of panic, or a threat outside of us, something important to us that's been violated, an object of ours has been taken, something we thought would be there isn't there. And what's important to note is that it doesn't matter if it's a real threat or not. If we perceive it as a threat based on what we value, where we are in life, what the context is, then even if it's not a real threat to other people, to anybody else, if it's perceived as a threat to us, our brain-body system gives us what we need to stay safe and protect what's important to us. So there's a response. Our brain-body system coordinates a massive release of stress hormones into our bloodstream. And what this does is it helps us do something. It helps us fight back or get away or freeze. It gives us the energy to intervene in the environment where we are experiencing a threat in some way. When that happens, you actually look at the diagram for a minute. If you think about this as a brain, like an animation of or an illustration of a brain, The, the front part that kind of looks like this part that's sticking out towards the text, that's what we think about as our frontal lobe. And if you are moving more towards the center of the brain, right, where it almost looks like that branch, that vein curls down and as if it's heading back into the spinal cord or the brain stem, that's the emotion center of our brain. And when we feel overwhelmed, when there is threat, all of the blood flows away from the front part of our brain, which helps us with reasoning and thinking clearly. And it moves all the way to the middle of our brain to help us respond to danger. So there's actually a fundamental change in our motivational systems in that moment. When we feel like there's stress or threat, how our brain is working is different than when we're at rest. And we call this arousal, activation, or the stress response system. If you look at all of the text that we just went through, that response, that system, that awareness of a threat, and then what happens inside of us and how our body and our hormones changes, that's a good system. We call it the stress response system. Now I'll explain that in just a moment. What I mean by that is that when we're thinking about the stress response system, just in general, right, come out of the specifics of your day-to-day for a moment and think about our survival as a human species. This response system is not a problem. It's not an illness. It's not a disease. It's good. And when I say good, what I ultimately mean is it's helped our species survive. If you've ever seen a kid run into the road, you've had this surge of energy to grab their back of their jacket and pull them back onto the sidewalk. Or if you've seen something unexpected fall off the back of a truck on the highway and you've grabbed the steering wheel really tight and your heart is racing and you feel this jolt of electricity, that's your stress response system. It's helped you in those situations to survive. It might even have been used to help other people survive. And we are less likely to be threatened and have our own stress response system activated by other people when we can recognize the symptoms of activation in ourselves and respond to our own activation accordingly. So in the last slide, you saw me talk about the stress response system within the individual, but here I'm talking about it in a relational context, that when somebody else's stress response system is activated, if we understand that that's part of how we survive as a species, and that that's because that person is experiencing a threat, even if it's not a threat to us, ultimately it helps us feel less afraid. It helps us feel less frustrated, angry, irritated with the other person, and more compassionate because we can see the value underneath it. And because it changes our perception of other people, if you think about the last slide, then they're less of a threat, which means our stress response system gets activated less. Here's some things that we know. If this feels like one of those things that we talked about on the front end of something to take away, these are a few good ideas. And when we're thinking about what makes us successful in high stress situations, it's predominantly these three things. One, we stay emotionally regulated even when the other person isn't. So you can imagine if one person's stress response system gets activated and they're yelling and they're throwing things and they're being rude and they're being angry and perhaps even starting to look like they might get violent. If we are activated and all of a sudden our stress response system is running through the roof, when we go back to that first person, they're perceiving us now as a threat. And we're actually adding to the threat in their environment, which is going to increase their stress response system. So when we are calm, when we are emotionally regulated, which means to say that we are handling what's happening on the inside of us in a way that's appropriate for our context, we actually reduce the likelihood of adding perceived threat to that other person. But, and any of you who have kids know this next point to be true, when we work with emotion and we validate and empathize and normalize, then we can give helpful information. Again, if you have had a kid who's had a tantrum, you know that is not the best time to start setting some rules and to communicate what's important and, really share family values. That is the moment where your kid is not going to hear you because they are just angry they got the red truck instead of the blue truck. And it doesn't matter if you think fairness is an important family value. So working with emotion and seeing that system I explained with the brain where the blood is flowing away from the reasoning part into the emotion part tells us how we help people. It tells us that we need to intervene and support the emotion system to help them feel heard and seen. It's a way of saying to their brain, the things that are important to you are important to me. Then the anger, the intensity, the fear can settle down because they're not trying to get their point heard. They're not worried that the things that are important to them are going to be violated in some way. And then we can start getting back to rationality and introduce information. Third point, when we take the subjective stance, when we're trying to understand what's important to the other person, we're more likely to see them with compassion, even if what's important to them doesn't matter to us. If we see people's reactions as irrational, we're probably going to be treating people in a way that doesn't support them to actually feel safe and present. We're probably going to escalate their stress response system because we're driving a wedge between the solution and what matters to them and some sort of problem. So we need to take a subjective stance. Instead of seeing, that matters to you, but it doesn't matter to me, we need to think in that moment, what really matters to them, and keep that in focus. Okay. We can break down a stressful situation into 5 steps. And that can help us feel like there's some linearity to it, a model, some sort of pathway to follow. Otherwise, it can just feel like chaos. And I'll show you a graph in a few moments that will help give you a visual map for what this looks like. But if you think about that first slide that I showed you, there's a perceived threat. Think of that as phase 1. And you might even remember this in your own example that we recalled earlier, where something happened. There was an event, an inciting incident in some way. So an internal or external event activates the stress response system. If we're already stressed, we're prone to further activation. Now, all of us know what that's like. We've had a stressful day at work. We were doing a million things. The commute was really hard, and we walk in the front door and somebody's upset at us. We didn't do this, we didn't do that, or there's a fight, the kids are yelling, or whatever it is. We see a bill on the table that we weren't expecting. And because we're already walking in fully loaded, so to speak, that new stressor can further activate us. If you think about the stress response system as happening, instead of like an on-off switch, more of like a gradient from 0 to 10, if you're already a 5 when you walk in the door, then it's not going to take so much to get you to a 10, which might feel like a crisis point. But if you're walking in the door at a 0 and something happens, then you have a little bit more room, a little bit more leeway before you feel like you're over the threshold and into crisis. So a trigger happens. That's phase 1. Phase 2, escalation. A stress hormone releases so we can intervene in some way. And we notice that because our heart rate is increased, we have shallow breathing, we might notice that we're not hungry, we have a dry mouth. We actually get activation in a very specific branch of a nerve called the polyvagal nerve, which helps us hear changes in tone of voice and pitch. So it activates some receptors in the inner ear so that we hear different kinds of noises and we hear things differently. Our muscles tense up because we're getting ready to defend or to fight or flight. And our pupils dilate, which quite literally is because our brain is saying, I don't care to notice the fine detail on that beautiful piece of art. What I care right now about is seeing if there's any more threat coming from anywhere around us. So field of vision widens. Third phase, the crisis stage. At this point, we don't have any rational judgment, right? We're fully in the protect, defend, or attack state. Our body is overwhelmed, perceiving that threat is all around us and happening to us, and we can't really get out. And so we're in distress at this stage. And this is the stage where we might do things that don't seem to make sense after the fact. You can think about perhaps examples of being in a conflict with a partner or a coworker where after you thought, why on earth did I say that? Right? This could be because we're reacting in that moment. We're actually trying to attack or defend. We're missing the judgment that tells us you don't really mean that when you're at rest. You don't really want to say that. And we might remember that happening for other people too. Other people have said things to us or done things. They've thrown something, they've slammed their fist on the desk, they've said something hurtful to us. Not because they really meant it, but because they were in some sort of defend attack mode. Now, after there's been a peak of intensity, our body can actually only stay there for so long before some systems come in and say, this is too much work to be here, to be so afraid. So there's some resolution, or it's been too long and we get fatigued. Ideally, there's cues of safety that tell us, okay, maybe I'm not in as much danger as I think I am. And if you think about a conflict with a partner, someone says, I'm sorry, I didn't mean to say that. And their face softens or their tone changes. Or they say, I don't like fighting with you. Or someone says, oh, yeah, I misunderstood. I thought you were saying this instead of something else. So there's some shift that happens, and our stress response systems begin to return to baseline. All of the things that started to get activated when we were stressed start the slow decline back to normal. Our heart rate starts to slow. Our breathing slows. We might have a little bit more moisture in our mouth, and our body tries to compensate. And this is when we get into this post-crisis depression phase, which is this huge wave of energy has been expended, and our body is really trying to compensate. And so there's a bit of a dip after. We can often feel some shame, especially if we've acted the way we didn't want to. We can feel some sadness, just fatigue. Sometimes this feels like that fatigue after a really, really, really good cry, just a tired body. All of that energy has been used up. And often when we get to this side, there's some insight about the event. We can see, like I was mentioning just a moment ago, wow, I didn't need to say that. That's not how I really felt. So you can picture this kind of like a wave. And here's what this wave looks like. If you look at the red wave as traced through these different 5 stages, you'll notice that the inverse response is related to quality of judgment. So as our heart rate goes up, as the distress goes up in us, we're actually seeing systems change internally, neurobiologically, so that we're not spending as much time thinking about what's rational, what's good in the long term, and we're just more reacting. And you can see that as you get to the post-crisis depression phase, this is not depression in terms of a clinical diagnosis like a major depressive disorder. This is thinking about a depressed nervous system, a nervous system that was really reactive and is now settling and kind of dips a bit before coming back to normal. When we, as people, move through stages 2, 3, and 4, the way we think changes dramatically. And you'll see we bolded and underlined there because I want to make it really clear that when we're dealing with high stress situations, it's really easy for us to do an us-them dynamic. Well, they're the ones who are overreacting. They're the ones who are crazy. We say all sorts of things about other people and their behavior. But what I want for you to know is that this is actually a human response system, that what matters to each of us might differ because of our life experiences, but all of us have the ability to be reactive and to say things we don't want to say and do things we don't want to say. When we're really desperate, when we're in more intense crisis situations with fewer resources, we might be carrying around more stress than some other people. And so we might be more likely to be reactive and quicker. But I really want you to see this as a human response system, that this is not us and them, but this is all of us. So when we become activated, we become more egocentric. We're just thinking about us and what matters to us. Our thinking is much more rigid and inflexible. When normally we could compromise with something, in those moments, we really back ourselves into a corner. More concrete, we have poor abstract reasoning. It's hard to use imagery and metaphor to communicate nuanced tones. It's all about what's happening right now in this black and white moment. We become more impulsive and reactionary instead of thoughtful, thinking about consequences. And we're less able to attend to and process auditory information. So we need to take in information in small little bits. This is not a great time to read the Odyssey or to listen to a robust podcast analysis of the political situation. In these moments, we need bite-sized pieces of information that tell us we're going to be safe and what matters to us is understood and validated by the people around us. So this is a good moment to think back to that high stress situation that you were in earlier. And if it was high stress for you, think about how you became focused. Solve the problem, make this stop. Am I safe? I don't like what's happening. And think about perhaps for the other person, how you could see that they were probably doing the same thing, much more egocentric, all about what mattered for them and keeping their things safe, concrete, impulsive. Okay. Now, what's really important about this phase, right here in the middle, you can see where that arrow is pointing. Between the trigger and the crisis, we're still able to receive safety cues. When we're at the point of crisis, it's too late, right? Our body has been overwhelmed by the threat or the perception of risk in some way. But in this sweet spot between 1 and 3, we actually have the ability to intervene. We have the ability to shift the course. So there are some instances where you would see go up to, there's a trigger, it goes up in escalation, phase 2, but things shift, things settle. We don't necessarily get to the point where there is total crisis. There's a blip, oh, okay, but then we understood each other, we found our way back to normal. So there is a possibility that it can look a little bit different than this. And that's because we're wired together as humans. We can signal to the other person with our posture, voice, and facial expressions that the situation indeed is safe and that the threat response isn't actually necessary in this moment. Now, it doesn't always work, especially for some people who aren't taking in cues from us, who are so fixated on the thing that feels important to them, and it's so essential to their identity or their survival that they can't necessarily receive from us. But a really good example of this would be for any of you who have little kids, if you've seen them see something scary and they look up at you looking for your reaction, and you cue to them with your smile and your voice and your face and your body language, oh, it's okay, you're safe, and you see them go back to playing. Right? That's an example of how we can cue another person into safety. So calm voice, open posture, open facial expressions, a soft facial expression, a warm, calm tone of voice. All of those things signal to another person's nervous system, hey, I'm not a threat, we can work together. Again, it's not always possible, but you can think about these skills as being useful in all sorts of areas of your life because we're all here. We're all human. We're all facing a stress response system at one point or another. And we all have a responsibility to help each other intervene and get back to safety. So what do we do, right? When this stress situation has activated, what are some of the things that we can do in that sweet spot that I mentioned on the last slide, or when there's a crisis? So we'll start with verbal or nonverbal interventions, how we can diffuse a situation nonverbally. So nonverbal signals might be more effective when we're in crisis. Everything that I was saying earlier about what happens to the thinking part of our brain and to the language receptivity part of our brain suggests that when we show another person with our body that we're not a threat, that the part of them that's looking for that threat picks that up and says, okay, this person isn't going to be one of the people who hurts me, so maybe I can interact with them. And you'll see this little illustration that I pulled open source off the internet about an open posture. So you could think about that as being standing or sitting. Sometimes it's harder if we're behind a desk and we're interacting with someone. They can't necessarily see our body in the same way, so it could be helpful to stand up, or just to make sure that we're really obvious that our hands are open, that our face is open, that we're not closed off and shut down. What we want to try and do is match a person's posture. So if they're standing, it might be helpful to stand. If they're sitting, it might be helpful to sit. We might want to increase distance and ensure equal access to the exit. So if you think about a person's stress response system as cueing them into where's the threat? Are there more threats than I even knew? What do I do? How do I stay safe? And what we mentioned too about pupil dilation, they're looking for what's a threat? How do I get out? And so if we're not blocking the exit and there's some space between us and them, again, it can cue them that we're not going to be one of those extra threats. If appropriate, use a barrier when possible that helps to stand behind a desk just to help that person and help you feel a sense of safety. Because if you are one of the people who feels like a threat to them, then we want to work on helping you feel as safe as possible, as grounded and regulated as possible, so that you don't add to the information that says this is a dangerous situation. We can move slower and less often. You can imagine quick movements might signal to them, uh-oh, I might be getting attacked. And as stated, we want to keep body posture open and our hands visible. Making eye contact and using nonverbal and paraverbal markers can be a helpful way of saying, I'm listening, I'm with you. So if you think about the classic kind of therapist face and nod, where there's the we think of those as paraverbal markers. You're not actually saying any words, but you're saying tonally, yeah, I'm tracking, I'm tracking. And if you have questions about a soft face, my note there, I can always answer those for you later when I turn my video on for us to ask questions. But think about that as being like a non-judgmental face, keeping our face settled and easy, open, as if we've just had a wonderful meditation. And here's some verbal things that we can do to help. Now, a really important caveat is that verbal strategies are best used to communicate empathy and understanding. Again, as I'd mentioned previously, information is not what a person needs when they're feeling overwhelmed emotionally. They actually can't take it in. It doesn't go anywhere, which is why if we've tried to share a really important point with somebody who's distressed, a kid, a partner, or communicate information before a person feels calm emotionally, we've known that it's been futile. So here are some things that you can do to help communicate understanding and empathy. Use their name, use a calm voice. I'll do that with you, Sarah, right now.
Yeah.
Sarah, I hear what you're saying. Right? So notice the tone of my voice. Notice the way that I said her name. I didn't say, Sarah, settle down. Right? Those are not the things that are helpful for telling a person that they're safe. We can repeat ourselves. It can be really hard to take in new information. Keep responses brief and simple. And pause before responding, allowing for silence, like I did there. Taking a breath, giving ourselves a chance to be thoughtful about how we want to respond. And then we can match and lower intensity. We call this down regulation. Again, this is a really helpful strategy. When anybody is distressed, we can say, yeah, I know, I hear you're really upset. Yeah, and I'm listening to you, and we're gonna figure this out together. And I'm right here. I hear how important this is. And so if you heard what I just did there, I was matching some intensity at the beginning, saying to that person, saying to you, okay, this is really important to you. And now we're going to take this road back down to safety. And you could hear my tone and my pitch and my pace slowing down. And you can do that in a sentence, in 5 sentences over the course of a conversation. But ideally what you're saying to them is, I hear you, I'm with you, and then you're telling their nervous system, hey, come with me. Let's go somewhere a little bit more settled. Again, we don't want to explain, correct, or challenge. These are not the best moments to provide the rationale for all of the decisions that you're making. That can happen later, but only when the intensity has decreased. Some more things. Diffusing the situation verbally. So as a faculty member in the counseling psych program at UBC, I teach all of my students this. I always say to them, if you don't know what to say and you're just learning how to do empathy, use this formula. You feel because you need. And so that could sound like you feel angry because somebody took your stuff and you need a solution. You need to get your stuff back. And in that moment, you're not necessarily agreeing or saying it's the most important thing to you too. You're saying, I hear you. I hear you. And when a person's concerns are heard, they can spend less energy trying to prove the necessity for their concerns to be heard. And their body can know, okay, I'm validated. Good, I can settle a little bit. Ultimately, we want to try and transcend the formula, but if you're stuck, you could try using this, right? You feel because you need. We can ask open questions. That's to contrast closed questions. So instead of saying, did you do that? Which is a yes or no question, or I'm trying to think of some other specific ones like, that's what happened, right? Yes or no questions. We want to ask things that open a person up, that give them a chance to talk and express. So these are questions like, well, what happened and how did it happen? And tell me more. And then what happened next? So we're asking a person to open up to us instead of closing them down. It can help a person feel emotionally less boxed in. Now, this can be hard, and this is an important skill to practice for any of us, but thinking about what we agree on. When you're listening to a person, that could even be a framework that you show up in the conversation with. looking for what do we agree on? Where are the commonalities? What do we have? What can we share? What can I give my full yes to about what you're saying? I agree. Having your stuff go missing is frustrating. And sometimes we can get there by putting ourselves in a person's shoes and thinking, yeah, if that happened to me, I'd have that reaction too. And provide reassurance. I understand how important this is to you. I can see how much this matters. I hear that you're concerned. I hear that you're angry. This would be scary. Yeah, I'm really listening. I hear you. All of those things say to a person, again, they don't have to spend so much time trying to convince us or see us as the adversary. Now, if you think about our last slide, it's a lot easier to think about what we agree on and think about validating if we're separating the behavior from the emotion. So I'll talk a little bit about emotion for a moment. Anger and fear are processed in the same part of the brain. They actually come with a physiological response, as every emotion does. Emotions aren't just the names that we give to them, but they're actually the felt sense of energy moving in our body. In fact, we have the funny little saying that emotion is energy in motion. It's emotion. So energy moving in our body in a specific pattern tells us what we're feeling. Anger tells us that something that we value has been violated or disrespected. Fear tells us we're not feeling safe, that we're under threat, we need to get away. We can learn to notice emotions as bodily processes that are separate from the behavior. So even as you're listening to me right now, while I am, yes, calm and deep, there are some things that are frustrating me. But I'm not slamming my desk, I'm not swearing at you, I'm not going on and on and on about it and trying to convince you of something. I'm feeling that inside my body, but I'm also able to notice that I can feel that and separate that from the way that I behave in the world. Now, not everybody has that skill, but it's available to everybody. And we can start to see the difference between things. We can start to see the difference between how a person is feeling and how they're behaving. And we can validate that emotion without necessarily supporting the behavior. It is possible to separate the two no matter what side we're on. And we can help people do that. We can say things like, I hear that you're angry, and please don't throw things at me. I can hear that you're so afraid. Please don't, fill in the blank. So here's another strategy. We've talked about nonverbal things, we've talked about verbal things, and now let's talk a little bit more about listening. We can use listening to understand, so really getting more information, getting into the other person's experience, and then communicate that understanding with care. These are all things that I teach in my counseling skills class. Paraphrasing, which is just offering the person's content back to them in your own words. Yeah, you're really frustrated because you thought there was going to be space and there isn't space after the person has told you this whole story. So just really feeding back to them in your own words what you heard them say. And a reflection of feelings, which is kind of like an abbreviated form of empathy. Yes, you're mad. You're so mad. I can hear how mad you are. If a person said, I'm mad, right? Actually noting the emotion word and saying it back to them does a very specific thing to our brain. There's a funny little catchphrase that we use in affective neuroscience, which is the neuroscience of what we do with emotion. And the phrase is, name it to tame it. The idea with name it to tame it is that when our emotion is named, when it is named by us or somebody else, it actually connects the language center of our brain and the emotion center of our brain and helps us feel a little bit more integrated. Okay, our needs are heard, I'm understood. Okay, so I'm not so much in threat anymore. And then an empathic response, showing care, concern, and deep understanding for why a person is distressed. And a summary, saying back to them, I heard you say this, I heard you say this, I heard you say this. Okay, when listening, try to do reflective listening, so not just passive. Again, using the nodding, matching a person's words, allowing for some periods of silence for them to talk, and communicate what you hear them say and feel, not what you think about it. So you're saying this instead of, well, I don't think that's a good idea. Saying, this matters to you. I'm hearing you say this about what's upsetting you. And acknowledge the obvious emotions, especially when named by them. When someone says they're angry, say, yeah, I hear you're angry. If people are cycling around content, that tells you that it's important to them. If they're yelling about something in particular, if they're very loud or they keep saying this one thing over and over again, acknowledging that can be a way to say to them, I heard you. So when it's time to assert yourself, some special skills are needed. So I'll run through these really quickly here.
And Hillary,
Yes?
feel free to take your time. People are appreciating what you're sharing, so no rush to
Okay,
the
great,
Q&A.
thank you. Okay, I wanted to leave some time for questions, but I'll make sure that I'm not rushing through anything important. Thanks, Sarah. When it's time to assert yourself, we might need to use some different skills besides the things that we were talking about on the last slide. Listening can get us far, and if somebody is not responsive to that, it might be time for us to change the situation in some way. So we want to do this when it's time to change, to keep ourselves safe or someone else safe. It's most effective when the emotional intensity is not at its peak. So when someone's not at a crisis and they can actually understand what you're asking and some of the intensity has decreased. There can be an increased risk if this is done at the wrong time. So if we're feeling really overwhelmed and reactive, we're not going to do this very skillfully, or if the other person is in their point of crisis. And here are some hows. So we can explain. Again, this is going to be much more successful if a person has settled a bit emotionally because they'll be able to take in information. So clarifying procedures, we do close at 7 p.m. and you'll see that here on this sign that's posted outside. Or correcting, I know somebody told you that this and this would happen. This is actually our policy, and here's where it says that. And setting limits, saying that behavior is not okay here. You are so allowed to be angry. You're not allowed to hurt people in this space. And offering alternatives. Instead of throwing things, why don't we try going for a walk around the neighborhood? Instead of throwing things, why don't you tell me in words you can use how frustrated you are? So explanation, correction, setting limits, and then offering alternatives. There are 3 ways that we communicate to people. There's nonverbals, the things that we're doing with our bodies. There's the paraverbals, how we're talking, and then the verbals, what we're actually saying. When we're trying to assert ourselves, we want these to be very consistent. If there's a discrepancy between these, our bodies are wired to notice that in other people and in ourselves, and to feel like there is actually more going on than we're letting on. So if we can be consistent, having a good posture, and that matches our tone and what we're saying, it's going to make sure that the message gets across loud and clear. So we want there to be enough space, upright in posture, and direct eye contact. What we're communicating is, I am in control of this situation and myself, and I'm very serious about what I'm saying. We want the volume to be loud enough that a person can hear us, but not so loud that they feel threatened. A slow pace of speech to say, this is not okay. Let's do this instead. You can notice how my enunciation changed and how in that moment of me giving that example, the tone is different than right now, where I'm conversational and there's a kind of rhythm or a sense in my tone of voice that I'm calm and maybe even playful. And our verbals, we want those to be brief and simple, as you've heard me demonstrate. Using a person's name, using I messages. I am not okay with this behavior. I don't feel safe. I need to leave. Whatever the statement is, using I statements instead of describing the other person is likely to stop them from being even more escalated. And we want to try and do is balance all of this with reflective listening. So we make our statements and we say things like, yes, I hear you're angry. Yes, I hear that does not make sense. I know this is so hard for you. And again, this behavior is not okay. So here's an example of some things that you could say. Describing what you see and hear, stating specifically the person's situation without judgment, expressing how you're impacted, and then lastly, stating your need. Specifically stating the other person's situation might mean saying like, I know that you are scared about this. Expressing might sound like, it's not working for me when things are thrown at me. It's not working for me when I'm called names. I feel unsafe when I'm being called names or somebody is screaming at me. Stating your own needs says, I am going to remove myself from the situation. I need for you to change your tone. I need for the volume in this room to be quieter so we can communicate respectfully. So here's some examples just to run through in your mind, and we'll take a few seconds to go through each of these. If a client throws garbage across the counter onto your desk, think about how you would describe the situation. How would you express what it's like for you? And how you would state your need. So just run through those things together in your mind for a moment. And again, a new situation, a client tells you to shut up and swears repeatedly. Perhaps describing the swearing, expressing what that feels like for you, and stating your need, telling them what needs to happen.
Hillary, can I just ask a question about the difference between stating a need and issuing an ultimatum? I know language is important here, so immediately I thought, I can't work with you if you're going to swear at me, which sounds like a threat as opposed to stating a need. I don't know if you can help out with that.
Yes. Yeah, I always think about framing requests in a way that focuses on our desire to continue being in relationship with someone. So instead of saying, I can't work with you, you keep doing that, saying things like, I want to help resolve this with you. For us to be able to resolve this, we need to be able to talk respectfully to each other. So thinking about asking what you'd like from the person and telling them, instead of, again, issuing a threat or saying, here's the consequences. What we're saying was we're backing a person into a corner. So stating our need could be a way for us to invite a person to join us. I want to help you. To help you, this is what it needs to look like for us. Or I need you to change in this way so that we can keep working together because I really want to help you find a solution. We're naming our desire to be in connection and to support and help. Does that clarify?
Yeah, that's really helpful. Just thinking about expressing the desire to actually help and continue or like invite someone into relationship as opposed to shut that relationship down.
Exactly.
Yeah, thanks.
You're welcome. And to this point, maybe people don't hear what we're saying and don't hear what we need from them. And the situation increases in intensity and it becomes hostile in some way. So that's a perfect time to disengage. And we can disengage skillfully and we can disengage without so much skill. So we want to talk a little bit about when that's needed. It's often more successful with joint responsibility. So I'm having a hard time collaborating, or I'm having a hard time, or it's not working for me to be creative with you right now because I'm struggling to feel safe and find all of the solutions I need. So I'm going to step away for a moment. When we're using joint responsibility, instead of blaming a person, we're naming, hey, we're not hearing each other right now. That's including me. I'm having a hard time hearing you. You're having a hard time hearing me. And this doesn't necessarily mean that we're accepting all responsibility, but we're saying to a person, I'm not going to blame you right now because that's probably not going to go super well for increasing my sense of safety. The other person needs to be acknowledged to minimize their likelihood of escalation. So again, we're prioritizing relationship. We're saying, I hear you. Again, you matter, what you want matters, but how we're doing this isn't working for keeping us both safe. So we want to start by acknowledging the other person. I can hear how frustrated you are, that I know you're angry because. Acknowledge your efforts. I want to do my best to help you find a solution. You could say, and I don't know how to do that right now, or, and that's really hard when we can't hear each other. So then state your immediate needs. Right now, I'm going to leave. Right now, I'm going to go consult and get some support about finding a solution. Right now, I'm going to step away from the space so I can take a few breaths and we can both have a chance to settle or to get some space. Or I'm going to leave because this interaction doesn't feel good, doesn't feel like it's working. And then we leave. And we don't have to offer any explanations. We don't have to say anything else. We've stated our need. We've stated what's going to happen. And then we can remove ourselves from the situation.
Just picking up on something that was on an earlier slide about not apologizing
Mhm.
or offering qualifiers. That's a real wake-up call to me, because I want to say,
Mm.
I'm leaving now, I need a break, but then I want to say, oh, I'm sorry, you know, or I'll be right
Yeah,
back, or maybe we can talk about it later, instead of just saying, I need this right now, I'm going to take a break,
exactly.
and I'm walking away. That's
Yeah.
very powerful and challenging.
It is challenging, right? And I think it's challenging too because we care about relationships. Like you were saying, when we're making a distinction between a threat versus stating our needs, it's really hard to state our needs when we want to stay connected. And some of us have learned that we can't actually have a need and stay connected, that we
Mhm.
can't take care of ourselves and care about another person at the same time. And so stating our need without qualifying or without apologizing can be hard for some of us more than others based on the relational stories we carry around with us. I'm so glad that you mentioned that, Sarah. It can be a really hard thing to do, to believe that we're caring, to believe that we're doing the best for that person and for us, and to walk away.
Mhm.
Now, when we hear that other people in our workspace are in distress, when there's a high stress situation that we can hear is going on for somebody else, this is how we create safety for each other. Because we also think about how we are responsible to the people around us. When we feel like we're alone in situations, we feel like people don't have our back, it can feel even scarier. So even when you're not in an interaction, I feel confident saying this, it's your responsibility to support your coworkers. And that can be something you do during or after or before. That can look a lot of different ways based on what's going on and what you're capable of and what they need. But here's some examples of that. When a crisis is occurring, engage with your coworker directly and use their name and state the reason for intervening. So Jane, I heard a loud noise. Is everything okay? Robert, I heard some yelling. How are you doing? Are you okay? What's happening? And what we want to try and do is approach from the side and stay at a distance. If we're entering into the scene, if we come too close, too fast, too directly, it can look to that person who's already in distress like we're a threat to. And all of a sudden they might feel ganged up on and actually feel even more at risk, more in a state of threat and become more hostile. This is not a point to engage the other party. Again, this is not because you don't care about them or not because they don't need help, but because we don't want that person to feel ganged up on. What you're trying to do is align yourself with your coworker and offer them something they might need. And then it's really important if the person says, thanks so much for checking in, I have this, it's important to respect that. And what that communicates to that other person is this person is in control, they're not alone in this situation, and that they have an idea of what's going on. Or if the coworker says, yes, I'd like for you to stay there, then they're telling you what they need in order to be successful in that situation. So if you are intervening, if you are going to go into that situation, it's important that you feel ready and available to do the things that they might ask you to do. Now, hopefully this isn't the case. For many of us, unfortunately, violent situations do occur when people are feeling stressed because they're activated, they're feeling like there's a threat, and they might be running out of solutions that normally might be available to them. So some questions that you can ask yourself that might occur even before things escalate. If someone walks in the door and you think, okay, this is a person who has a history of violence and I'm alone, maybe I should call one of my coworkers and let them know I need some support up front. Or go into a situation with another person, or put some more space in between you and them. So you can ask yourself the question, does this person have a history of violence? Have they actually stated threats? Because if a person comes in and they're feeling calm, but things start to escalate and then threats are made, that's an indication that they might be heading towards violent behavior. Are they using substances? Do you see signs of physiological activation? Is their jaw clenched and are they showing their teeth and are they making their fists and is there blood pumping and you can see the veins in their forehead pumping blood? Are they blocking exits? Are they behaving impulsively? Are they expressing extreme emotions or scanning the environment or behaving like they're suspicious. So all of those might be signs that some violence is coming. So if that's the case, you want to make sure you're in really visible locations that aren't private so that people can see and so that you have lots of space. Maintain eye contact. Right? This is to keep you safe, but also to signal to them that you're with them, that you see what's going on. Maintaining safe distance, again, to decrease the sense of them, of you being a threat to them, but also to give yourself space to get away if you need to. And knowing your exit routes. It's important to note that you know that you are able to get out of a situation. And if there aren't some exit routes or if they're blocking the exit routes, it's a good time to think about calling in support, de-escalating the situation, getting through it in some way so that you could make the exits available to yourself.
And Hillary, just thinking back to my own experience working at a very busy community center where, you know, if I look at this question, history of violence, stated threats, using substances, showing signs of physiological activation, that's, you know, 50% of our clients at all times.
Right.
But the interesting thing for me to reflect on is that a lot of this stuff is around preparation. So I know the layout of my workspace. I know who's on shift with me. I know my exits, and I know how I'm positioning myself in that space, even before I go into work, or I'm very aware of that. And I'm also building that with coworkers. So, you know, if one of them's on a break and I know that there's, or if someone says to me, it's happened lots, I'm going on a break now, is that okay? And I say, actually, can you just wait? You know, Joe just arrived and we both know blah, 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 right? So yeah, there's some preparation around this as well.
Yes, and that helps when you know yourself, when you know the space, when you know the clients that you're working with. You're so right that these things make it feel safer to be in what might otherwise feel like an unsafe situation because we have a command of ourselves and the community and the context. I'm so glad that you added that in. So some do's when there's the threat of violence: stay calm, or at least project calmness, offer choices, identify the seriousness of the situation, call for backup, make sure that the people who are there with you actually show up and are there with you. Again, as Sarah, you were saying, knowing where the exits are. These are things that you can do before there's a threat of violence and also during. And it might be that during is too late. So having a sense of how to stay calm, knowing people's names, knowing choices you could give people in different situations if they felt unsafe or if they needed something, if they were angry, and knowing, like you said, who is on shift with you and who's available and making sure that they're around when you need them is all part of helping you feel safe and stay calm. And then the don't, right? Label or criticize a person, present as uncaring or impatient. That tends to signal to the other person that what they care about doesn't matter to you, and so they actually need to increase their intensity in some way to communicate how important it is. This is the worst time to argue with somebody, to try to prove a point. Again, the things that we tend to say when we're overwhelmed are calm down or quiet down. But generally that doesn't work for another person. If they're really distressed, that might seem like we're silencing them or shutting them down. And that can be, it can feel even more like a threat. Cornering them, making sudden movements or turning your back, or engage them on your own. Again, you might know the specific people that you're working with, and so it might be easy to think about, hey, what's worked in the past for helping this person settle? Or what have I seen from a coworker about what's worked and what hasn't worked? And you can pick tips up along the way when you're paying attention. But essentially, we want to stay away from minimizing a person and their concerns or increasing the sense that they're at risk or in a threatening situation because we're there. When there's a mental health concern, it can be scary because people behave erratically at times, but the data shows us that they're not actually more likely to become violent. The problem is that the unpredictability or the seeming instability emotionally can make it feel unpredictable to us and scary for us. And if a person is in distress for mental health reasons, they might actually be looking for cues that they're safe and that somebody's in control. And those cues might need to be verbal, but they might also be paraverbal or nonverbal. So again, we want to move slowly, explain actions before taking them. That can sound like, I'm going to move over to this chair, or I'm going to get us a glass of water. Or what you're going to see in the next moment is that I move some of these things so that we have a little bit more space. And naming the challenging behavior in a calm, direct, and brief manner, stating explicitly, right, when you are doing this behavior, right, it's creating some challenges in this environment. If people are confused, you can remind them where they are, use their name, and orient beside them instead of across from them. At times, orienting across from people can feel confrontational. Now, it's really important for people who have a psychotic or schizophrenic presentation. We can have the tendency to want to shake a person back into reality and say, no, that's not, that thing that you're seeing, it's not real. And yet in that moment, it's exceptionally real to that person. And so it feels like they're even more alone if we're not participating in the delusion with them. That being said, we don't have to participate. We might get into a situation where we're involved in what feels real to them, but might feel very out of control and uncertain for us. So we want to avoid participating in or challenging the delusion. Reassuring you're safe. Right here, we're going to be focused on this task. Right here, right now, I'm here with you, using their name. This is not a time to confront them about delusions or hallucinations. Because we're involved in these situations, here are some things that we can think about to help ourselves before we go into work. And I love what you said, Sarah, about the prevention piece, that when we show up to situations and we feel present and we feel calm and we feel like we know ourselves and what's happening, we're better able to respond with all of our creativity and all of our tools should something happen. So this means taking time to check in with yourself even before you go to work. I often sit, it depends on what I'm doing for work, because I do lots of different things for work, but before I start whatever it is that I'm about to start, especially if it's going to be emotionally intense, I ask myself, what am I feeling? What are my stress levels? And then thinking about making the best decisions based on what you're capable of and given your current state. That might mean if you have a chance to do something administrative at the beginning because it helps you shift gears because you just had a fight with your partner or something stressful happened on the bus. Maybe you negotiate tasks with coworkers so that when you really are interacting with people, when you are moving into what could be high stress situations, you have all of you available. And then practicing mindfulness, using self-care and stress-reducing activities between work and play and all of that, and starting the day, especially if you're in a rush, starting your day with a few deep breaths, a few moments of mindfulness to remind yourself, I'm here. I often do a visualization where I imagine setting all of the stressors that I'm carrying on the shelf beside me. That could be things like unfinished business at home, or a friend who's in crisis, or a worry I have. And I can pick those up at the end of the day. But when they are inside of me and I'm carrying them around, I'm loading that intensity. That means that I'm more likely to be reactive or stressed when something happens than if I came in with more of a blank slate. During an experience, it's really important to notice your internal reactions. So if you feel yourself getting hot all of a sudden, just noting that. You don't need to move into trying to control it or make it go away. And then reassuring and supporting yourself. How we talk to ourselves about ourselves actually plays into what's happening in our body. So being able to say, okay, I can do this. Or wow, noticing, wow, as soon as that person said that hurtful or threatening thing, I got very afraid in that moment. That made me think that they were more of a threat than they are, but actually I'm really well resourced here and I know how to do this.
One of my favorite phrases that I say to myself is, this is not an emergency. So oftentimes I'll be activated, and I've had this happen many times where immediately I'm at a 10, but the situation might be stressful, but it's not an emergency. There are times when it is, but saying this is not an emergency. It is critical, but I can handle it. And just that one phrase often helps me de-escalate myself.
Absolutely. Yes. Yeah, I'm so glad you shared that. And one of the ones that I use for myself is, this is hard and I can do hard things. Right? Reminding myself that I have the capacity to meet challenges and succeed at them. whether that's a challenge because it's a task or a challenge in a situation that feels tricky interpersonally. Taking deep breaths slowly with long exhales helps our body return to the present moment. Breath is one of these magical things that helps us shift out of our stress response state. Again, it's not a great idea to say to somebody else, take a deep breath, right? As if we're trying to force them to calm down. But we can ourselves take long breaths, slow breaths, like that, to help our nervous system shift that perception, knowing, okay, this isn't an emergency, but I do need to be focused and pay attention here. Directing our energy and concerns at acknowledging and hearing the other person. So if we find ourselves focused on what's going on for us and what's happening for us, we might be missing important information in the other person that helps us actually get to a solution. Being aware of our posture, just noticing our body. Sometimes we don't even notice things like we're clenching our fists or we're tightening our jaw. And so when we're noticing we're getting activated, we can take a breath and allow our body to be soft. And then getting supports is needed. And disengaging to emotionally regulate. You are allowed to say, I need a moment, I'll be right back. You are allowed to say, hey, I need to sort something through before I help you with this. They don't need to know that the sorting through is your own anxiety or your own emotion, but you're allowed to take a timeout if you need. And then after, regulating, noticing that we carry all of this extra energy in our body from a stressful situation, and getting that out of our body actually helps us know, okay, we can come back to a state of rest. And we can do this through touch, right? Giving ourselves a hug, gross motor movements, so big muscle movements like jumping jacks or doing a running motion or some push-ups, or even going for a walk, having a glass of water.
I used to run up and down the marble staircase at the community center.
Yes, exactly.
To get that, just even for, a couple of flights, just to get that excess adrenaline out of my body.
Yeah, it needs to be used up. Otherwise, it hangs around in us. And when it hangs around in us, then guess what? We're more loaded when the next person walks in the door with a kind of average concern. We're already seeing it as being more stressful than it needs to be. And humming or singing, those things activate a specific branch of our nervous system that tell us, okay, we can be calm, we can be here. And then tightening or releasing our bodies. I have on this slide there progressive muscle relaxation, which is great for, again, using up the energy in our muscles. Maybe it's not safe to go run up and down the staircase, or maybe that's not available to you physically, but you could tighten all the muscles in your body and then release them, and then tighten them again, and then release them. The regulate, relate, and reason 3-step model comes from Bruce Perry's work. He's a psychiatrist who's worked with emotion and trauma. And so this is his framework. Relating, connecting with someone who's safe, ask for them to listen to you, tell your story, and then reason. So only when you are regulated, only when you feel connected and grounded, will you try and reason with yourself and make sense of what happened. And think of that as the exact process that you're engaging with other people. We're not asking other people to understand information until there's a bit more connection and calm. And so we're not going to do that to ourselves too. So last 2 slides here of content. Here's some things that we need to be thoughtful about. And again, because I've talked about stressful situations as being interpersonal, that we are involved in either contributing to the stress or helping regulate it for another person. When we are distressed, we need to do a better job of taking care of ourselves so we can show up fully and be more present. I'm not sure if anyone has seen the Angus Reid poll that came out this week, but 50% of Canadians are saying that the coronavirus has impacted their mental health negatively. And that's increased stress, increased anxiety, depression, increased compulsion behavior. And that's including people from every walk of life who were accessible by the institution that was polling them. So this is really impacting us. It's not impacting everybody the same way necessarily, but it's likely to think that this is going to mean that we're coming into work with a bit of a different energy. And so we need to be better at taking care of ourselves. What I found is that to do the job that I was already doing without any increase in like volume or frequency, I'm having to do far less of the rest of the stuff, far less socializing, far less running errands. I just don't have as much energy as I did before. So if that's the case for you. Think about how you can protect your energy so you can give most of it to the places that you need to give it. So limiting screen time, anticipating fatigue, knowing that it's normal right now to be tired, making extra time for yourself to discharge that stress response, making time for movement, expression, and your spiritual practices. Mindfulness, making sure that you're starting your day, ending your day, perhaps even waking up in the morning or right before you go to bed, taking some breaths and just noticing how you're doing. Again, looking for these moments where you do feel gratitude, connection, pleasure, and delight. It's important when we're stressed and when there's lots of threat around us to train our brain to see what's good, because it can be really easy to forget about that stuff. Not that we want to negate the intense emotions, that those need room. And we want to tell ourselves, okay, and where is the beauty? Where can I look for it and find it? Even if it's in the cup of tea, or seeing your neighbor's face as you go out onto your balcony at 7 and clap and holler together. Okay. Sarah, I'm trying to move the slide deck forward. I can't seem
Oh,
to get
yeah,
that.
I was
Oh,
hoping you would talk about PMR at the very bottom there.
oh yes, okay, yeah. So I mentioned on the last slide, progressive muscle relaxation is a way to activate all of the muscles in our body to use up that stress response, that mobilization system. And you could just think about this in the less fancy terminology as just tightening and releasing. And so we can do it together now for a moment. If you want to have your hands in front of you. On 3, we're going to make fists as tight as we can. 1, 2, 3, tight fists. And I'm going to count down from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, now take a big breath. Uncurl your fingers and your hands. You might notice some burning, some heat, even if you want to flap your hands around a little bit or stretch them or wiggle them or give one hand a rub from the other hand. And letting your body settle a little bit, taking some big breaths, letting your hands come to rest.
Wow, that was kind of awesome.
Yeah. And if we do that with most of our major muscle groups, either at once or in sequence, so our face, our shoulders, and then our hands and our arms, and then our core and our seat and our legs, we're using up all that extra stress energy, and we're also teaching our body to move out of it into a rest state. And what that does is it helps us practice finding our way home. When there has been distress, this is the route. We use it up, and then we find our way back to a settled space. So that's a quick version of PMR.
Great. Here, I'll move it forward for you.
Okay, thank you.
There you go.
Okay. So a quick note on this, because not everybody that you're going to be working with, not everybody that's in our lives is going to be treating both the limitations and the boundaries we need to set around coronavirus the exact same way as we're going to be wanting them to, or even our policies suggest. So when we're trying to get someone to change their behavior in a specific situation where they're kind of resistant or they don't understand, here are some strategies. An invitation to partner with. So here's how you can help me. I actually need your help. To help me, could you do this and this? So we're using language that says, like, not you're the problem, you need to change, but you're a part of this community. You have a responsibility. You get to join us in making this safe for some other people. Identifying shared responsibilities and collaboration. For us to be able to help you, we'd like for you to help us by doing this. So again, partnering language. It's okay to validate misunderstanding or confusion. I know it doesn't make sense. This seems so strange that things have shifted so much. Again, all those skills that we used and practiced earlier in the presentation around validation and receptive listening. But when we share with a person that their change has an impact on us in a positive way, it can activate some sense of belonging in a person that makes them more willing to compromise or do something that they would otherwise be unwilling to do on their own. And then to give a person an opportunity for leadership. So you're actually an important member of this community. You have an important role to play in helping keep some of your friends safe. So here's how you can do that. We would love for you to be a leader in this community. And lastly, like I mentioned, normalizing, validating the difficulty. I know this doesn't make sense. This is so hard, which is why we so appreciate you doing the work to shift things. Again, you can hear my language is really relational. It's really about focus on what the person could do well, could do right, and inviting them to behave in a way that is about us believing that they are capable of change. When we believe certain things about people, they tend to be self-fulfilling prophecies or prophecies that come true. If we believe a person is delinquent, then they're not going to feel connected to us. We treat them differently. And what choice do they have but to become that way? But when we believe a person is capable of change and we invite them into the possibility that they could behave in a different way, it makes it so much easier for them to believe that that's a possibility too. Okay, so I want to come back to where we started. Perhaps there's something to remember that came up for you. I'm just taking a moment if you wanted to write this down, if you haven't already. Something you already do well. Something to change. And something that you want to practice. Here are some references, some sources from which I pulled material and content and theory. So if you want to see more and learn more about some of these things, here are the places to do that. And that's the end for me.
Thank you, Hillary.
You're so welcome.
So we've got a few minutes for questions here, and I'll kick us off while I'm waiting for everyone to gather themselves. Two things came up for me. Oh yeah, let's put ourselves on video here so you can see Hillary.
Hey everybody.
Do you want to demonstrate that soft face that you were talking about earlier?
Oh, yes. Yeah. So if you can see, like sometimes when we're listening to someone, we do this, like, yeah, right. Or some of us have what we might refer to with particular colloquial language, but we might call like an intense resting face, if you will, where we're like, right, that's kind of like the normal. And so when we think of a soft face, we think about open eyes, something that looks like that. Maybe even some concern in the eyebrows. Not, or like, or even, right, this kind of face that looks kind but neutral. Thank you for reminding me.
And it kind of makes me think about what you were talking about and noticing that your jaw is clenched. Or that your shoulders are stiff. That often, I would get that feedback at work. Are you mad at me? Oh no, I was just thinking about my bike ride home, right?
Yeah, that's right. Sometimes other people tell us what we need to be aware of. They give us that feedback. If lots of people are asking questions like, are you taking this seriously? Right, that might be a cue to us that our expression, like we're laughing and giggling at things that are serious, or we're like, it looks like we're not paying attention, even though we're really focused because we're staring off into space. So just noting those things can be helpful for us to get feedback on how other people experience our facial expressions.
I really like how you framed it in terms of something we can practice and something that we can take away. And I was just reflecting on some sadness that I feel actually because I worked at Carnegie for 5 years and I did learn a lot of good skills. And it's interesting the question you asked, what do I already do well? If I look back at that time, I think, wow, I really gained a lot of insight and skills and tools to deal with constant high stress situations. But there's also a bit of sadness there because things were always so intense. And I just wanted to say, and also just maybe ask as well, you know, for example, I was serving about 600 people a day. You know, 80% of them had mental health challenges or other challenges, and a lot of the interactions were hostile. And I guess I want to say this as a bit of compassion, and that is, we're not always going to do it perfectly every time. Even if you've done it 100 times before, or you know, there were days where I'd go to work and I'd be doing well, and other days where I just couldn't handle it. And That didn't mean I'd failed. It just meant the level of stress or the tasks I was being asked to do were too much for me as one person.
Mm-hmm. I'm so glad that you said that. When we are not proud of our reactions in retrospect, the tendency can be to shame ourselves or to add judgment or guilt. And yet the irony is that none of those things actually change our behavior. They tend to add to the stress load that we're carrying. So we're already stressed. We've behaved in a way that we're not super proud of. And then we beat ourselves up for us and we expect that to make us do something different. When the reason we behaved that way in the first place is because we already had so much on our plate.
Mm-hmm.
It seems, again, kind of ironic or counterintuitive, but actually what we need most in those moments is what you just modeled there, this compassionate responding to say, wow, that's not how I would love to be on my best day. That was a lot that I went through. That's a lot to carry. I was doing my best that I could at that moment. And how can I take care of myself now? And when we do that, then we're actually decreasing our stress load. We're decreasing the stress response system that's going to make us behave in ways we're not super proud of.
Mm-hmm.
I'm so glad you mentioned that.
Yeah, I think it's a common, I mean, we talk a lot about burnout and vicarious trauma, especially in frontline work, but I think it's a common trait to blame ourselves when we're not coping.
Mm-hmm.
And obviously this whole workshop is about how to handle things and how to manage them. But I just do want to acknowledge again, we're in a dual health emergency right now. And a lot of us have been carrying the burden of the previous health emergency for a long time. And so, the way to manage some of these situations is to recognize our limitations.
Yes. Yeah. Beautifully said.
Do you have any thoughts or last comments to share here, Hillary?
I think there's so much to be said for knowing ourselves, knowing our reactions, noticing what happens in our body. And when we're thinking about this presentation, a lot of it was focused on how do we respond outward? How do we say or do things that can shift a situation towards something that feels more safe and relatable and helpful for both people involved. But the truth is, when we are dysregulated, when we have all of that stuff we're carrying inside of us because of even the ongoing stressors of doing this work, it's so demanding day in, day out. And then going home and like life is just hard right now for a lot of us, that we might neglect putting as much attention here as we need to. And so while there's skills that focus outward, my hope is that all of us take time to get to know what our reactions are like, notice where we carry stress, if it's in our jaw, if it's in our face, what happens when we get reactive, if we're more likely to blame or more likely to freeze. And the more we know ourselves, which comes from spending time getting curious and being insightful and asking questions and paying attention, the better able we're naturally able to do some of these things that I suggested.
Mm-hmm.
So my hope is that, like you said, we can be caring for ourselves. And one of the ways of caring for ourselves is to go inside, to notice and be with what's happening, and to name when things are stressful, and to get to know how we respond.
Yeah. Hillary, thank you for your presence today. And I've heard you speak before, and we've had conversations in different contexts, and I really appreciate the way that you present, very scientifically grounded with a lot of theory, but in a way that is really accessible. I really like that. I feel safe listening to you, knowing that
Thank you.
you know your stuff, but you also understand what it's like to be human. Yeah.
Thanks, Sarah. That's really, I take that in. Thank you.
And we're getting some love on the chat here for you as well. So,
okay.
Yeah, hopefully, I feel like this is a workshop that we could do again. And I'm just going to do a couple of wrapping up pieces here.
Great.
So you're welcome to keep sharing your face or not.
I turned it off there.
Yeah, that's good. Okay, so thanks to everybody for joining us. If you have questions or you're a person who's reflective and you've just been kind of taking in all of this incredible information and presentation and you want to ask questions of Hillary, you can do that in a couple of ways. You can put that in the survey. We've got a spot there for specific questions, or you can email us or give us a call and we'll get you connected. And of course, you can always get in touch with us in these various ways. You can find all of this information. We'll be recording. We recorded this session as well as we'll put it up as an audio file in our podcast feed. So you can listen to that however you like. There's a handout there, and all of the resources are available on our website. So thank you for joining us. And Hillary, just again, thank you for putting this together, for sharing yourself and your research and your time and your expertise. And we really look forward to having you on again.
Thanks so much, Sarah. What a pleasure to be with all of you today.
Yeah. All right, everyone. Well, stay safe, stay calm, take care. And I say this every webinar, but I mean it every time. On behalf of HSABC, thank you for showing up. Thank you for walking into stressful situations. Thank you for working to care for our most vulnerable in this time of crisis. Take care, everyone.